Lurasidone is an atypical antipsychotic used to treat schizophrenia and depressive episodes associated with bipolar I disorder. In this video, let's find found. What is lurasidone? What class of drug is lurasidone? What is lurasidone used to treat? Who cannot use lurasidone? What are the side effects of taking lurasidone? How does lurasidone make you feel? How to use lurasidone? What is lurasidone? What class of drug is lurasidone? Lurasidone, sold under the trade name Latuda among others, is an antipsychotic medication used to treat schizophrenia and bipolar disorder. It is taken by mouth. Common side effects include sleepiness, movement disorders, nausea, and diarrhea. Lurasidone was first approved for medical use in the United States in 2010. In 2013, it was approved in Canada and by the United States Food and Drug Administration to treat bipolar depression, either as monotherapy or adjunctively with lithium or valproate. In 2019, generic versions were approved in the United States, but will not be available until 2023. In 2020, it was the 259th most commonly prescribed medication in the United States, with more than 1 million prescriptions. What is lurasidone used to treat? Lurasidone is indicated for the treatment of schizophrenia in patients greater than or equal to 13 years old. It is also indicated as a monotherapy for the treatment of bipolar depression in patients greater than or equal to 10 years old, or in combination with lithium or valproate for the treatment of bipolar depression in adults. Who cannot use lurasidone? Lurasidone is contraindicated in individuals who are taking strong inhibitors of the liver enzyme CYP3A4, ketoconazole, clarithromycin, ritonavir, levodopa, etc., or inducers, carbamazepine, St. John's wort, phenytoin, rifampicin, etc. The use of lurasidone in pregnant women has not been studied and is not recommended. In animal studies, no risks have been found. Excretion in breast milk is also unknown. Lurasidone is not recommended for breastfeeding women. In the United States, it is not indicated for use in children. What are the side effects of taking lurasidone? Side effects are generally similar to other antipsychotics. The drug has a relatively well-tolerated side effect profile, with low propensity for QTc interval changes, weight gain and lipid-related adverse effects. In a 2013 meta-analysis of the efficacy and tolerability of 15 antipsychotic drugs, it was found to produce the second least, after haloperidol, weight gain, the least QT interval prolongation, the fourth most extrapyramidal side effects, after haloperidol, zopine and chlorpromazine, and the sixth least sedation, after paliperidone, sertindole, amisulpride, iloperidone and aripiprazole. Pharmacodynamics. Lurasidone is a benzothiazole derivative that is an antagonist and binds with high affinity to dopamine 2D2, key equals 0.994 nm, 5-HT2A, key equals 0.47 nm, receptors, and 5-HT7 receptor, key equals 0.495 nm. It also binds with moderate affinity to alpha-2C adrenergic receptors, key equals 10.8 nm, and is a partial agonist at 5-HT1A receptors, key equals 6.38 nm. Its actions on histaminergic and muscarinic receptors are negligible. How does lurasidone work? Lurasidone is an atypical antipsychotic that is a D2 and 5-HT2A, mixed serotonin and dopamine activity, to improve cognition. It is thought that antagonism of serotonin receptors can improve negative symptoms of psychoses and reduce the extrapyramidal effects that are often associated with typical antipsychotics. Half-life: 40 mg, dose equals 18 hours, 120 mg to 160 mg, dose equals 29 to 37 hours. How to use lurasidone. Schizophrenia. Indicated for schizophrenia. 40 mg POQ initially, not to exceed 160 mg per day. Initial dose titration is not required, shown to be effective in a dose range of 40 to 160 mg/day. Bipolar depression. Monotherapy. Indicated as monotherapy for adults with major depressive episode associated with bipolar I disorder, bipolar depression. 20 mg POQ initially, may increase dose if needed, not to exceed 120 mg per day. Monotherapy study. Higher dose range, 80 to 120 mg/day, did not provide additional efficacy compared to the lower dose range, 20 to 60 mg/day. Adjunctive therapy. Indicated as adjunctive therapy for major depressive episodes associated with bipolar I disorder with lithium or valproate. 20 mg POQ initially. May increase dose if needed, not to exceed 120 mg per day. Are there specific concerns about lurasidone and pregnancy? The FDA has classified lurasidone as a pregnancy Category B agent, although no adequate or well-controlled studies of the drug's use have been conducted during pregnancy. That's all the information about lurasidone we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.